VitaScan LT is a portable instrument for measuring bladder volume. It's battery operated and both safe and easy to use. This non-invasive bladder scanning method is based on ultrasound. The real-time registration of ultrasonic reflections makes it possible to differentiate the urinary bladder from the surrounding tissues. The VitaScan LT automatically calculates the estimated bladder volume and displays it on a screen. VitaScan LT is applicable in many clinical areas to determine bladder volume, time for bladder emptying, and detection of post-void residual volume. A graphical image in real time makes it easier to detect the bladder before scanning. VitaScan, your perfect choice if you are looking for a flexible solution. The VitaScan LT hard case displays a USB ultrasound probe, a memory stick, and a holder to secure the probe on a top plate. Read the enclosed instruction card. Download the user manual and find the software installation procedure on page 12. After a successful installation, an icon will appear on your desktop. Run the application VitaScan LT from the desktop. Select gender, male or female. Select obese for obese patients. Palpate the patient's pubic bone and apply the gel immediately over to the patient pubic bone. Smooth the gel out and remove any air bubbles that may block ultrasound transmission. Press Pre-Scan button on computer or probe and pre-scan until the bladder is localized. The bladder image should be in the center of the screen. Press Scan button on computer or probe to start the volume measurement. Keep probe still until volume calculation is done. Verify the scan. 2 real-time scans are displayed on the screen: vertical and horizontal scan. A green image shows position of the bladder. The green image should be in center of the treed cross. CAR V means current volume. Max V means maximal volume. The maximal volume calculated on this patient if the reset button has not been activated. Press Clear Restart to reset Max V. Reset before scanning another patient. InvMeasure equals invalid measurement. Press Pre-Scan and re-aim. Ensure that the whole bladder is captured inside the sector and that the bladder is in center. Volume below 30 milliliters will not be recorded, and this message will be displayed. The result can be saved by pressing Save. It will generate an exact image of what you see, including user information and volume result. The default name for saved file is a timestamp which may look like this. You may change this to another name if required. Saving scans to a specific patient is done by selecting Setup before starting the scan procedure. Enter patient name and other optional data. Press Done and leave the menu. Then start the scan procedure. When saving the scan, click Save, open the patient's catalog and save the scan. The result can be printed by pressing Print. It will give you the option to select a printer and choose if you want to print the picture in a landscape or normal orientation. To load an old scan, press Load and select the scan you want to see. It will load up the picture from hard disk. To exit the application, press Exit and Yes. Remove gel from patient abdomen and from probe. Clean and disinfect the probe according to hospital guidelines. Remember to test system before scanning the patient. Use a sufficient amount of gel. Pre-localize the bladder and aim to localize the whole bladder within the sector. Reset and clean the system before using it on another patient.